Today we're going to learn how to write a nursing care plan. A nursing care plan is an essential tool to ensure comprehensive and individualized care for each patient. So click the link in the description below to gain free access to these care plan templates that you can fill in later. We also offer tons of care plan examples to help guide your learning. From med-surg to mental health, we got you covered. So the first step in creating a nursing care plan is assessment. This involves gathering both subjective and objective data. So starting with subjective data, this includes the patient's statements about their condition. For example, I've been feeling nauseous and dizzy. Now, objective data, this includes measurable information like vital signs, lab results, and physical examination findings. For example, a blood pressure of 140/90 and even a temperature of 101. Remember, a thorough assessment is the foundation of an effective care plan. Now, moving on to step number 2, nursing diagnosis. These are critical judgments about the patient's health conditions or needs. A nursing diagnosis has 3 main components: problem, etiology, and symptoms, PES for short. So the components of the nursing diagnosis, starting with P for problem. This identifies what is unhealthy about the patient. It describes the patient's response to the health condition or life process. For example, acute pain. Next is E for etiology. This identifies the factors related to the problem, often referred to as related to factors. It describes the possible reasons for the problem or conditions under which it developed. For example, related to surgical incision. And very lastly is S for symptoms. This lists the signs and symptoms, often referred to as evidenced by factors. It includes the objective and subjective data that signal the existence of the problem. For example, as evidenced by the patient's verbal reports of pain and grimacing. Now, moving on to the types of nursing diagnosis. Starting with an actual diagnosis. This indicates that the problem exists and is supported by defined characteristics, like signs and symptoms. For example, acute pain related to surgical incision as evidenced by a patient's verbal reports of pain and grimacing. Next is the risk diagnosis. This indicates that the problem doesn't actually exist yet, but risk factors are present. For example, risk for infection related to surgical incision. Third is the health promotion diagnosis. This indicates a patient's readiness to improve their health and wellness. For example, readiness for enhanced self-care as evidenced by expressed desire to manage diabetes more effectively. Next, we have syndrome diagnosis. This includes a cluster of diagnoses related to a certain event or situation. For example, post-trauma syndrome related to physical assault as evidenced by nightmares and anxiety. So here are a few example nursing diagnoses. Impaired physical mobility related to pain and discomfort as evidenced by limited range of motion and reluctance to move. Now moving over to step number 3, the planning. The planning stage involves setting goals and desired outcomes for the patient, as well as identifying appropriate nursing interventions. And remember, goals must be specific, measurable, achievable, relevant, and time-bound. The SMART method. For example, the patient will report pain level of 3 or below within 24 hours. Now moving over to interventions. These are actions that you will take to achieve the goals. For example, administer prescribed pain medication every 4 hours as needed. Next is step number 4, the implementation. Implementation is where you put your plan into action. This involves carrying out the nursing interventions that you have planned. And speaking of actions, this includes administering pain medications as prescribed, educating the patient on relaxation techniques to manage pain, and even assisting the patient to comfortable positioning. You must ensure that you document all actions taken to maintain a clear and accurate record. And lastly is step number 5, evaluation. This is the final step. Here you will assess whether the patient's goals were met and determine the effectiveness of the interventions. Now, with evaluation criteria, we simply review the patient's response to the interventions. For example, the patient reports a pain level of 3 within 24 hours. We want to modify the care plan if necessary based on the patient's progress and feedback. So let's go through a quick example of a nursing care plan. Let's say we have a patient, Mr. Jones, who's 68 years old. He's post-operative, day number 2, after a total knee replacement surgery. So for assessment, if Mr. Jones says, "My knee hurts a lot when I try to move," this is a subjective assessment because the client is saying this. Now for objective assessment, these are things that we measure. For example, blood pressure 150/90 and a pain level 7 out of 10. Now in terms of nursing diagnosis, it can include acute pain related to surgical incision, as evidenced by the patient's verbal reports of pain and elevated blood pressure. Now moving over to planning. The goal here is that the patient will report a pain level of 3 or below within 24 hours. And for interventions, administer prescribed pain medications every 4 hours as needed. Apply ice pack to the surgical site and educate Mr. Jones on deep breathing exercises. Now moving over to implementation. Administer pain medications at 8 o'clock, 12 o'clock, and 1600. Applied ice packs for 20 minutes every 2 hours. And lastly, instructed the patient on deep breathing exercises to help manage the pain. And lastly is evaluation. For example, the patient reported pain level of 3 at 2000 hours. Or the patient was able to perform deep breathing exercises effectively. So to wrap it up, here are the key steps to writing a nursing care plan. It all starts with assessment, nursing diagnosis, planning, implementation, and very lastly is evaluation. By following these steps, you'll ensure comprehensive and individualized care for your patients. Remember, a well-constructed nursing care plan is your roadmap to effective patient care. Keep practicing and you'll become proficient in no time. And just a reminder, be sure to click this link here to get access to our free templates. Thanks so much for watching, and I'll see you there. Thanks for watching. Did you know you can unlock beautifully handcrafted study guides, packed with key points and memory tricks from all our videos? Plus, you'll get access to over 1,200 exclusive videos not on YouTube, all neatly organized by nursing school topic, to make that complex nursing knowledge actually stick. You'll also gain thousands of practice questions written by current professors and actual NCLEX writers. So for access to all of this and more, click right up here or visit SimpleNursing.com. And don't forget to subscribe to our YouTube channel. Happy studying, and we'll see you in the next videos.